All right, I'm going to introduce Kurt Jahrling, and he's going to talk to us about ocular prosthetics. He began his career in 1983 after graduating from college. Went into the family business, am I correct?
Mhm.
Yeah, with an apprenticeship. He is in the American Society of Ocularists, board-approved diplomat ocularist, and on the National Examining Board of Ocularists. He's also achieved his fellow status in 2011. Um, he's been published in the Journal of Ophthalmic Prosthetics and is currently chairman of the National Examining Board of Ocularists. I am lucky that my son Max gets to go to Jahrling Prosthetics and he wears scleral shells. But we're going to learn a little bit about how prosthetics are used and how prosthetics are made. So if you have any questions, stick around afterwards. We'll be able to answer them. And Kurt and his family, their office is actually right up the road. So,
Yeah.
right?
The Boston office.
The
Yeah.
Boston office. They have several locations. So, all right. Go.
Okay. Hello. Well, thank you for this opportunity. Yes, as mentioned, in a lot of these practices for artificial eyes, ocularists, there's many family businesses, and that all dates back to when these were glass eyes, and I'll talk about that in a little bit. But our practice started by our father back in 1962 officially, but he started in 1950 in this. And my siblings, Joyce and Eric, joined in. I'm the youngest. And my eldest sister was a secretary there, so it's really family business. My father passed away last April, but to carry on, my daughter, the third generation, has stepped in. So artificial eyes, most people think of them, you hear the term glass eyes. And yes, since the 1600s, that's when glass eyes were really started, but it was not until the mid-1800s where the Germans had really perfected a method of blowing glass to create the artificial eye to have some more fullness to it than just a simple shell. And this, my brother and I both go to Germany, and we work at a glass eye maker shop making plastic eyes for people who want plastic, because still in Germany, glass is king. So what's the process of making the glass eyes? The patient would come in, there's a giant selection of eyes there. The glass eye maker picks out the best one that fits and then creates one to the person's color. But back in the at World War II, the whole supply of glass wasn't there because of the boycotts and such and lack of trade with Germany. And what also developed too was plastic. And during that time, the plastic eye emerged in the mid-1940s, and two methods came about. There was the one method of making a whole bunch of plastic eyes, and they'd be called stock eyes. And another method was from the Army Dental Corps, where an impression method was used to create the form. And I'll go into that later. But what I have up on the board now is a picture of a glass eye, a plastic stock eye, and then an impression fit eye. And what happened there was the glass eye was fitting well, but then the stock eye that was poorly made and not really fit to the person damaged the person's soft tissue of the eye socket, and they ended up with contraction. And there you see the smaller impression fit eye that was now the true shape of what was needed underneath the eyelids. So just through the years, most of our patients do have the eye removed, either through enucleation or evisceration. And what that entails is the use of an implant that's placed in the orbit to take up the volume of the lost eye, and it's covered in tissue that's similar to inside the mouth. So through the years, so many of these implants came about. There was magnetic ones with pegs and posts, but the most common one is a ball-shaped implant that's placed in the orbit. So I have pictures of what it looks like in the socket in the next slide. So if you're a little squeamish or your lunch isn't sitting well, you can turn away. So in this picture here, we have the first one that's a more common shape, the ball implant in the far audience upper left. And then there's a very rare peg implant, another one that has little nubbins on it that helped capture movement, and a little ring one in the bottom audience left. And there's also one with a titanium peg, which they fell out of favor recently because of some complications with that. So I'll move on. So the process of making the artificial eye now is to take an impression. A lot of these materials that are used are from the dental field, dental alginate, dental acrylic. We order our gypsums and plasters from the dental suppliers. But it starts out with the impression of what's behind the lid, whether there's a small eye there or if the eye's been removed and it's working over the implant. So this impression is, we have at the ready, you have impression trays, as seen up on the slide there, of varying sizes to fit underneath the eyelid. And once that's placed under the eyelid, the impression gel is mixed. It's a strain sensation. It's not painful. It feels cold. If there is sensitivity, an opthane or numbing drop can be used, placed under the eyelids. So the impression gel goes in, and it goes in like a milkshake and comes out like a hard jello. Once that sets up, that's put into a plaster mold, and in that plaster mold, dental wax is used and poured into that plaster mold, and to create a wax eye at first. So the wax is used to see how well the comfort of the shape is, work on the lid opening, work with how it captures the movement underneath the eyelids, whether the implant or in some cases the small globe. And there's a fitting process that goes on. It could take an hour, sometimes 2 hours, depending on the complications that are going on. If needed to do modifications to that form or build up the front surface to lift the eyelid better. But once we're done, there's a centering pin that's placed on the front surface of that wax model, seen in the slide right. All right, so to further talk about how we derive the shapes, the other situations are over Tycho globes or smaller eyes, microphthalmia, which is an underdevelopment of the eye, or in cases where a larger globe has been disfigured and needs a cover shell. Also, again, an impression is taken, but instead of a wax model, since we're working with a cornea present, the shape has to be more exact. So we'll go into a clear plastic shape made from that mold of that impression. The patient comes in, we try in that clear shell, we do modifications to it to make sure that it's comfortable. We have to enhance it as much as possible to make sure we capture as much movement as possible with the underlying natural eye there. And in most cases, the patient takes this clear shell home with them. They try it out, whether they work on the wearing time as being 1 hour the first day, an hour and 15 the next, an hour and a half. Just it depends on the sensitivity. But if they do just fine, then it might be a matter of just, if they have never worn anything, to help stretch the soft tissue around the eye that the shell is covering. In cases of microphthalmia, where the eye has been underdeveloped, impression is taken, we go into that clear shell, but depending on the severity of the underdevelopment of the bone structure or the lack of time since ever wearing a shell, they may go through a series of enlarged shells over the course of time. So whether it's a new shell every month, every few months, it may last 3 to 6 months before we actually make one that looks like the other eye. So in cases where we're dealing with a larger globe that was disfigured, you can see in the middle slide, the gentleman has a contact lens over it. But because of the eye has shrunk down a bit, the contact lens doesn't do a lot for the lid structure itself. So what we've done here, take the impression, goes through the clear shell process, and then from that create the matching eye on the other side, giving it more volume to lift up the lids. So talk about the artwork. So patient comes in for their impression and fitting of the wax model, and we'll sit with them to match the other eye color. And often that's done with a disc. And we will go for the pupil size, and varying sizes that are out there. And you can see that the variable of iris pupil sizes that we have to deal with or match to. And we sit with the patient, and it may take 30 minutes, may take 2 hours to match the other eye present. And then we can control the depth of the iris, if there's a deeper chamber, shallower chamber, with the level of the amount of acrylic over it. All right, so once you've got the wax model with the pin or the clear shell that's been modified for the sizing of the matching eye, a mold is made of it. This is a gypsum and a plaster mold. 2-piece mold is done. And once that 2-piece mold is made, and after the iris has embedded in acrylic and given a cornea and a stem, in that empty mold now we mix up a clear acrylic, a methacrylate, polymethacrylate, and embed embed the iris in white acrylic. Patient comes back, we remove the front surface of the white acrylic over the iris, expose the iris size, and with the patient present, match the other eye, the white of the eye, and even possibly do any touch-ups to the iris color. Once that's completed, it goes back into the mold, and a clear acrylic dough is mixed up. It's pressed onto the surface of the painted scleral matching. And once that goes through a heat and curing process, it comes out with a hard acrylic on the front surface, where the front surface is trimmed down and polished. Am I going too fast? Any questions at this point? No. Okay. All right, so let's go over a case of a patient I had recently. She was born premature, underdeveloped eyes, and it turned out I'm sorry? Oh.
Yes, please.
So she had an undeveloped left eye, and at the hospital, because of her lack of cooperation, we had to take the impression under anesthesia. So it was a light anesthesia, and she was under for maybe 10 minutes. The impression was taken. The process of the impression takes 2 minutes. I came back to the office and made a mold of the impression. If you can see on the right slide there, the impression of the globe. And we take that impression, we may add a little wax to the front surface of it, make a 2-piece mold of it, take out the wax and the impression material, and in that empty cavity, press clear acrylic dough. What you're seeing on the molds is a latex that we have to put on the mold to protect it. So under a compensating press, it is put under pressure. If you can see in the right slide, the pressed form. And at this point, it's soft. Place it into another press, and it goes into a dental cooker, a pressure cooker, at 100 degrees for 30 minutes. The process of curing acrylic, it can be done with dry ovens, boiling method, microwave. At this time, the most popular is the pressure cooker that makes things a lot quicker. So once it comes out, it's in a rough form, but it's hard acrylic at this point. And the slide there, I'm trimming down the edges and then going to be polishing the front surface. The patient comes back, and on this day, she was very sleepy. So in the office, we fit the shell, tested her reaction. She barely woke up. You can see in the slide, difference in the slides there on her right side, how much more volume is going on there with the clear shell in place. So at a later date, she came back. I got to have a better look at her. She was awake. And we decided to continue. We were going to just go with this form, but enlarge it slightly with a wax. And for that process, she wasn't the most cooperative. And we had a lot of observation. I took a lot of pictures, made markings on the shell. There was some crying, but most often it was just never letting me get a good look at her. Always moving, just good exercise. So finally, with markings and getting some looks, I was able to put that stem on the front surface, and we had, in a previous day, painted her iris color, and that was embedded in acrylic, given a cornea and a stem. And here's the process again, where the mold is protected with the latex, the white acrylic dough is pressed around that iris and placed into the mold. It goes to that heating process again under heat and pressure, becomes the hard white acrylic around the iris. Expose the front surface, expose the iris from the white acrylic. She came back in. On that day, she was also very tired. I had to lift up her right eyelid to get a good look at the white of her eye in iris color to check on that. It goes back into the mold, given clear acrylic, cured to the front surface. Once that's gone through the process, it's trimmed down and polished. So most often it takes a situation where the eye has been removed. We can do this in one day and 3 appointments. When we deal with working over a blind eye, we have that one day of taking impression, fitting the clear shell, then we turn into a month, and then they spend 3 appointments with us, usually on the same day, to create the matching artificial eye. So there she is with her prosthesis. Luckily, she was awake for the pictures for these. All right, so how are these maintained? 1, never clean them in alcohol. As you can see in the slide right there, it'll destroy it. We try to keep it simple, cleaned with baby shampoo. If we're dealing with a situation where the eye has been removed and we're dealing with that tissue that's more like inside the mouth, the prosthesis can stay in a month at a time or even longer in more external cleaning. Baby shampoo is used. There's other special products for lid scrubs. If needed, artificial tears. The whole success of an artificial eye is keeping them clean and keeping them lubricated. So whether it's the natural tears are doing the job enough or the need for some help there with some artificial lubricants. Way a prosthesis is removed, it's either putting pressure to the lower lid and wiping it from the nasal side outward, or with a device called a suction cup. Has a little, in the past they were made of rubber, now they're made of silicone, where the suction cup is wet, there's a bulb to it, it's pressed to the surface of the eye, and it's with that adheres to the prosthesis and from the lower lid taken out. Reinserted, lifting the upper lid, placing under the upper lid, and then with pressure still upward on the prosthesis, pull down the lower lid. So what can happen if these aren't maintained, the salts and proteins from your tears can stick to the surface. And on slide right there's what's called GPC, it's giant papillary conjunctivitis, which it's irritation, and it's the tissue of the lid forms these little bumps which produce secretion and kind of worsen the problem too. So they need to be taken care of, cleaned properly as needed. Everyone is different. If we're working over a blind eye, most often it's removed at night, but it all depends on the integrity of the cornea and the eye itself if it needs to be taken out that often. And being plastic, the In most cases, we can modify the shape before the need to make it new. In this case here, the patient's looking a little cross-eyed. And we can do some modifications to the back, to the front, try to go with the same contours and straighten out if the prosthesis has become displaced. Or even being plastic, we can add a wax to it and then make a mold and exchange that wax for plastic. Or even if you're liking the color of the eye that you made and it's sitting pretty good, but it's loose fitting, we can take a new impression and then redo the back based on that impression in new acrylic. So these artificial eyes, if we're dealing with a child, by age 1 to age 20, they may go through 5 new eyes in that time period and then some adjustments in between. Once you get past the age of 20, it's more like 10 years, 10 to 15 for a new prosthesis that's needed. Some ocularists do believe every 5 years, but we've always just been in the practice, if everything's working, just leave it be. And this patient here, he waited a little bit too long to get his new eye. It's very crooked, and it's strange how people won't notice. Things happen so slowly with the look of their eye that they think everything's looking normal until somebody says something to them. And just a couple examples of just unique cases where people actually they kept the same eye for 20 years and from their childhood. The first one, the woman there, maybe it was a little bit big at the fitting, so it lasted longer for her. Probably on the gentleman on the right, he should have probably come in sooner because the lid was starting to droop. There was gaps forming in the corners. And it's up to the patient too and their families to know when it's time to get these things adjusted and enlarged and such. I am just speeding along here. All right, so in conclusion, I mean, end goal, there's going to be, when we're dealing with children, there's going to be a lot of tears and wrestling matches at times, but in the end result, you're hoping you're going to put a smile on everyone's faces. All right, thank you very much. I'm very sorry I'm so fast on this, but...
Can you talk about why some patients benefit from wearing shells?
Right, okay, so...
Facial structure.
All right, so yeah, back when I was with the micro-ophthalmic situation, the earlier the better, as far as getting the presence of that scleral shell over the globe, because it stimulates the bone growth of the orbit. And the earlier the better. There are methods I've seen where it's a little too aggressive using gel situation, but that's different as far as with the presence of a micro-ophthalmic globe or a testicle eye. But it's scientifically shown of the shell's presence actually helps the bone growth of the orbit there. Having it there and having the upkeep of it being a firm fitting, to the point of, being comfortable but still firm fitting, helps stimulate the bone growth. Any other?
Protective qualities for the eye itself?
Well, it does both. There is some protective qualities, but if they're not maintained well, then yeah, cause a little irritation, and then there's problems there. So
I know you said the earlier the better, but is there like a time that you really, you would suggest starting this if you're going to, an age?
from 6 months to 3 years, I think the most benefit can occur. But then even the presence of the artificial eye, it does...
It's going to raise the eyelid and
Right.
change the appearance of it.
Yes. Exactly.
I have a question.
Yes.
So, in an adult, the shells, like, when Nathan was born, it wasn't really, I don't think it was really, I kind of heard about it later.
Mm-hmm.
And then some of the mothers in this group had shells made for their kids, and I was like, okay. So now Nathan's 26. I know the bone growth is already, he's an adult.
Right.
So
mean, it would be a cosmetic, you know, it would be for cosmesis.
Mm-hmm.
I used to wear contact lenses, and they fit me initially with hard lenses, and I was like, oh my God, they hurt so bad, get them out, and then I did great with soft lenses. So if you're fitting an adult, you know, like a baby who can grow into it, and it's just kind of a normal way of life for that baby.
Mm-hmm.
If you're fitting an adult who's never had anything foreign in their eye, like is there pain? Is there no pain? Does it feel like a contact lens?
Right, so that whole impression method that goes into the clear shell,
Yeah,
that's what we call that the trial phase.
okay,
And there are people will do the impression, fit that shell, we'll get massive tear flow going on and sensitivity. But that's how we go. You try it for an hour, and then the next day an hour and 15. And then in most cases, it's successful. You take it slow. And if it has not ever been something worn, there's soft tissue that can develop around the globe itself too. So just the presence of that shell can even not reform, but reposition that soft tissue around the eye too. And so it may take a couple of those clear shells to get to the point where things get comfortable, things are push that soft tissue around to increase the movement that can be achieved
right,
working with the natural eye muscles underneath.
right.
So,
So in Norrie's, you know, there's not normal tracking, you know, eye tracking. So if you have a shell, does it use the ocular muscles to?
right,
I mean,
yeah, so to be
it's-
comfortable, it has to move with what the eye's doing.
Yeah. So it's definitely in cosmetics. Like I said, everything is formed already because they're adults.
Mm-hmm.
Do you do many eyes on people that are totally blind? Like not where you're using one eye to match the other?
Yes,
You do. Like for shells and so.
right, shells or, I mean, there's the way people end up at our office, there's accidents and diabetic patients where both eyes are affected. And yeah, so there's a fair amount of patients we have that are working with both sides. And then there's a selection of colors that can be done and
Yeah.
creativity that way too.
So now does insurance pay for that or is it private pay?
Each insurance has different coverages, and that's always been the battle. So it's up to you. You check with your insurance.
So some insurance companies consider it cosmetic,
Right.
right?
Yeah, we're in this odd category of,
Or they try to do it as eye, like glasses, eyewear.
right, we're durable medical equipment,
Okay.
same as oxygen tanks. Yes, you're in the front?
Yeah, so just adding on to that question, so it sounds like for an adult, the main benefit would be like cosmetic. Is there any other benefits of doing it at that point? Like you've never had anything in your eye, never had anything in your eyes?
Yeah, I'm not sure what the level of comfort of having the lids open more, if there's less drag felt. But it is probably more in the adult, more of a cosmetic issue.
And then would your eye have to be significantly smaller in order for, like significantly smaller than it should be in order for the shell to fit over it?
Well, if the lid opening without the shell has a slight droop, then it's higher success of the end result being more balanced. So we can make these shells under 1 millimeter thickness.
What do you do if a patient has light perception?
Yes, we can actually clear, in some cases, the microphthalmia, and other cases where you suspect some light perception, then we can have the pupil area cleared out, or just grayed so light can come in, or just go with the clear acrylic shell over the eye and have the patient go at that to bring in the light and stimulate.
So that would be, in that case, that would be for just changing the eyelid drooping and things like that. If you weren't as concerned with how the eye actually appears, you know, the iris and stuff appears, you just want the eyelid to be shaped a little bit better, you would go with.
And the bone structure, bringing in more light to the globe.
Right, so you would go with the clear in that case instead of the painted one.
Right. Yeah, I recently did, there was some suspicion that the child might have some light coming in, so I had, in the final process after matching the white of the eye, you get the clear in the front, and then it went back into the mold, and I took away the back of the prosthesis and put clear plastic back there. So there was, it still looked like a matching eye, but in the center pupil area was all, light was coming through. Any other questions? Yes?
So how easy is it for a blind person to clean these things? I mean, because I have hearing aids and they're really hard to clean. So I'm just curious, I mean, these, can you just put them in the solution you were talking about? Just kind of like soap or?
Yeah, Bausch and Lomb has some products to clean hard contacts, which can work. But a lot of it is just it's baby shampoo, maybe a soft toothbrush, a good rinsing. A lot of patients are very successful, blind patients, with dealing with the prostheses. It's a lot of feel to the surface of the prosthesis also. You can sense it, you can feel a little of the salty buildup on the surface that you haven't cleaned off enough. And just be more aggressive with a cloth or even your fingernail behind a tissue and just make sure it's all smooth.
He's looking for a girlfriend.
Yeah?
I mean, he's got a dog, and he always says, everybody thinks his dog is so cute. He's like, well, what about me?
Yeah.
So, you never know. Could have some possibilities.
Some Frank Sinatra blues, maybe? We can...
Maybe. You never know.
I didn't know there was something wrong with my eyes, but I mean, I don't know what they look like, obviously. Maybe they're bad. I know they don't stay open, but that's just because the muscles aren't there.
Well, it's more of a volume situation if the eye is closed.
But it could be like picking out a cute outfit or something, having, blue eyes or green eyes or whatever makes you happy.
Yeah.
Oh, the rest of us don't get that choice. I think that's neat. Yeah.
Yeah, a gentleman in from the Middle East, and he was in a horrible bomb explosion. And he came in with brown eyes, and he says, I want blue. And he came in with his fiance, and she says, she doesn't know anything about this. So I made him blue eyes, and he walked out with blue eyes, and I don't know how it all went from there, but I'm not sure you hide that. But
Last time we were in, Max's eye color changed. Got darker.
you chose to go darker, or you?
No, I think we could match it because the previous set were from somewhere else, but Joyce helped us and she hadn't seen our other children. And coincidentally, the color she chose is the same eye color of the other two guys.
Mm-hmm.
Just randomly, so now they all have the same color. But with the volume question, like I do notice that when Max has the shells in, it's not as, now that he's 10 and he's older, but I think we all know when they're babies that everybody says, oh, they're sleeping. If they're in their shopping cart and playing or talking or eating in a restaurant, just because their eyes are closed, they're like, oh, they must be sleeping. He's so, with the shell in, his eyes are open.
And you say you always get compliments on his eye color.
People
He has the
always,
prettiest eyes.
people will say, oh, his eyes are beautiful, and I don't even think about it. And one time we were living in Florida, and he just got them. And I said, oh, thanks, you just got them. It was like at a checkout, like at the grocery store, and the lady looked at me like I had like 10 heads. And I thought, oh, but then now I find myself, because it's just part of who Max is now, I forget to tell people. So like a new babysitter, or like a driver, because they drive into school, and sometimes they flip, like or they turn, like they never come out. But they'll look back and like one eye will be looking at me, and it's like different direction, and I'll get a text message like,
Something's wrong here.
something's wrong here. Does anybody else have any questions?
Can they make them from glass?
Well, you might have to send it to Germany.
Oh, okay, so they used to make them from glass.
Yeah, well, in Europe, and in Germany especially, the glass is still more available than the plastic.
Will they protect your eyes, like if traveling and such, and like, you know, I mean, because you can still damage your eye even though you have an eye.
Right, so I guess there's a level of protection there going on them.
Like from a tree branch or something overhead that you may.
Yeah, because it would push on the prosthesis, in a way protect the globe underneath it.
Yeah.
So I
You
guess
can
it's,
put them over your existing eyes.
Yeah.
yes.
I never knew that, because I always thought that it was just like people that didn't have eyes, you know, or something was really wrong and they had to get their eyes taken out. And so that's interesting. Yeah, I learned something.
You
Yeah.
didn't bring any today, did you, by any chance?
I'm sorry.
Because a lot of people have probably never seen them or touched them or.
Right, I have some in my house I came from, and I forgot to grab the little collection I usually bring the things.
You
I'm
don't
sorry.
have a keychain? I work in
You
a
got-
hospital. All the nurses have them as a keychain.
Oh, really?
Yeah.
The eyes was a
Well, I work
key?
in an eye hospital now.
Oh.
So, but yeah, so yeah.
Well, like the office, I can run to the office and come back in a bit. If you want to see some, sure.
It would be great. I think probably a lot of people
And
haven't seen them or
I
touched
can
them or,
return them. I'll return them to you.
unless you
Oh,
want
okay.
to borrow Max's and, you know.
Well, Max's are in his eyes.
Yeah. No, I'll go to the office, I'll grab
Back in
some
Hopkinton.
for samples. But back to the question of the over your eyes, that's what the beauty of the impression method is. It accurately creates a fitting prosthesis that's comfortable to fit over the eyes, as opposed to the glass, which was more fit empirically, but just by sight by the ocularis. But the impression fit just makes it go to what's there. It makes it more comfortable. That's why these less and less doctors have removed eyes in situations that they would have in the past because of the success of being able to keep the natural eye, even though it's disfigured, that these results come out really well because you have all the natural muscles and such.
Yeah, I had a question. Our son, he had surgery and then he developed scar tissue, so he stopped getting the fluid, producing fluid into his right eye is smaller.
Mhm.
And each time we go to see our retinal surgeon, I'm worried that he's gonna say that, we need to start a shell. So like at what point do you, just like measuring the size versus the eye socket, or what is the decision that you decide to go ahead?
Well, I think the doctor would come to the decision if they're sure there's no sight going on.
I'm sorry,
There's no sight.
not in that eye, no.
All right, so it sounds like it's time. It's how old?
He's 4.
All right, yeah. It's even, that's a little even touch late, but still can be beneficial because the skull keeps growing, and I mean, most of it's done by age 10 or 12, I believe. But still, even at age 26, I think there's some bone growth that still goes on, so.
Do you mean like with the size difference? Like,
Yeah,
is there
because
like a?
it's still growing, but it's smaller than the left because of that. It was like I was probably like 6 months and he just didn't have pressure in his eye at all.
The actual globe changes?
It's just not growing, is what you mean?
It's growing, but it's smaller.
It's growing
And
less
so-
and less.
Yeah, because we did, difference in the size, but it's continuing to grow, but each time I think, I'm wondering if he's gonna say, I think it's time to put a shell in to help.
We had to bring it up. We weren't told when we got pushed towards this, it wasn't that we got pushed towards it really, it was that we said, now, just for aesthetics, how do we make things look even and look, and then that's when we said, oh, well, if you want to, I guess there's this thing. It wasn't something that they came and said, oh, you really have to go and talk to somebody, it was that we had.
No, they don't bring it up.
You'll get that conversation if you have like, you're missing the eye or it's really, but if you're on the edge.
They just let it go most of the time, what we're seeing,
Yeah, but it's borderline, which is where kids are, and then you go.
I think ours came up because Max's eyelid was flipping under, and the eyelashes were scratching the eye, and it was like, well, how do we stop that from happening? Well, you gotta have, some volume
Yeah,
to keep the
eyelashes out.
yeah. So
But
that's,
yeah, we did not find that they brought it up because ours, we didn't have a situation like that needed to be fixed. It was just something that we looked at and said, okay, the eye isn't growing at the same rate the rest of the head is, so it's looking a little bit deflated, and how, do we want to do something, and it was on the edge. So it's something that if you want to, you just
What do you do with, so
We could match what we see on the other side, and we also done situations where we put a normal iris on the other. So, but I'm just surprised that the globe itself, the doctor says, is still growing, or
Or
it changes.
Time under exam under anesthesia, and each time we're like, do we need to do anything yet? And he says, no, not yet, because it's still growing, and he feels like it's gonna still keep. But each time I'm just anticipating, I didn't know if there's other things, because we only see him once a year, if there's something that we could be watching.
Yeah, so the whole concept of the eye growing, once it's reached, it's shrunk down or so, or been underdeveloped, usually that's what stays most often the same. And then what you're dealing with is the growth of the bone structure and working the soft tissue with the presence of the shell over it. So.
You guys see a plastic surgeon? Brought this up. We were just like, okay, we can bring in this guy who specializes in this, and he can help you make that decision.
Right. So that's more of a.
Grow accurately, or whether you need help.
Right. So that's an oculoplastic surgeon, not just a plastic surgeon who does
That's it.
other oculoplastic.
And how would you recommend if people were interested, like they in their hometown, like where would they?
Right. So you may start with contacting the ocularist in the area, and then they have their connections and recommendations for which doctors also. And there's the ocularist, ocularist.org can help, finding in your area and around the world too.
Board certified.
Yeah, board certified ocularists means they've gone through the educational program and passed a certification exam. So you have a much, I guess not that they're all fantastic, but you have a better chance of a better ocularist.
Do we have any more questions? Kurt, thank you so much, and we'll work on getting some of the shells.
Yeah, well, I'll be right back.